This video is intended for adults 18 years of age and older. If you aren't 18, I respectfully request you stop the video now. If you are over 18, please understand that this video is for entertainment and educational purposes only. I encourage all persons to follow all laws governing your state and county of residence. All subjects discussed in the following video are legal within the state and county in which it was recorded. Hello everyone, welcome to another video from Kiari Life 420. Today I want to discuss cannabis and using it to treat chronic pain. Most of the people that come across this channel are going to know and have a good idea what chronic pain is, but some may not. So I want to explain the difference between chronic pain and acute pain. Acute pain is pain that is in relation to an injury or an illness that is temporary. As that illness or injury is healed, the pain dissipates and eventually goes away. But some injuries and illnesses cause changes to the body that are long-lasting and sometimes indefinite, leaving the person more susceptible to pain. And that is what's referred to as chronic pain. Chronic pain, it lasts longer than 3 months. It may be constant. It may be intermittent. Chronic pain is also caused by inflammation or dysfunctional and or damaged nerves, and this is referred to as neuropathy. Common conditions associated with chronic pain include arthritis, muscle pain, headaches, spinal cord diseases, spinal cord injuries, cancer, HIV, etc., etc. Traditional treatments for chronic pain include acupuncture, massage, CBT, which is cognitive behavioral therapy, physical therapy, and medications. Common medications are generally anticonvulsants, like gabapentin and Lyrica, corticosteroids like prednisone or hydrocortisone, muscle relaxers such as Robaxin or Flexeril. Under certain conditions, NSAIDs, but I haven't come across that personally. And then that moves into opioids or narcotics such as oxycodone, hydrocodone, morphine, oxymorphone, and of course that, it's a controversial topic because a lot of people get called addicts when the body, yes, if you stop taking that medication abruptly, you will have withdrawal symptoms from it, but it doesn't make you an addict, and at any rate, that's another video. But slowly over time, cannabis has been considered as another form of treatment for not only chronic pain, which is what my main focus is, but also a myriad of health benefits. So how does cannabis have the potential to help reduce or relieve chronic pain? The cannabis plant contains cannabinoids such as THC and CBD, and when ingested, these cannabinoids bind with the endocannabinoid system in the human body, and they influence the CB1 and CB2 receptors in the human body. CB1 reflector receptors are primarily found in the brain and in the nervous system, and they are more responsible for the relation with the THC's psychoactive effects, and the CB2 receptors. They're numerous in the human immune system and found throughout the body. And when activated, the CB2 receptors play a role in the activity of the immune system and inflammation. CBD has the potential to reduce chronic inflammation and pain. CBD binds to opiate receptors and alters how they respond to stimuli, ultimately reducing pain. Whereas THC, the primary component in cannabis that causes the euphoric effects, helps to relax the body and bind to the cannabinoid receptors in the brain to reduce the pain sensation. Cannabis also contains several terpenes that also has a potential to play a role to help reduce chronic pain. Some of those terpenes, because there are many, but some, and I'll list them in the description, are the beta-carotene, eucalyptol, limonene, linalool, myrcene, and pinene. So you're interested? What's the best way? Okay, so what's the best way to consume cannabis for chronic pain? Well, the best way to consume cannabis, it depends entirely on you, your physiology, your personal endocannabinoid system, your medical concerns, your lifestyle preferences. You know, there's a whole lot of different things that would make us unique to different types of ways of partaking. Smoking is the most popular thanks to its fast-acting effects. Some people who are concerned with the inhalation of the carcinogens found within the plant matter, they take the option to vape, which also is inhaling. However, it doesn't put flame to the plant. It actually heats it up to a degree in which the terpenes and cannabinoids burn, but the plant matter itself do not. And that's all you inhale, which is a much healthier way of consuming. And that's without burning the plant matter. Edibles are another option that provides longer lasting effects. But you should know edibles, whereas smoking, the right can affect you immediately. It could take up to 15 minutes to get the full effect. Whereas edibles, onset might be 45 minutes later after you consume, and then it could take up to 2 hours for you to get the full effect and benefits. Some people find edibles are a whole lot easier, and some find it that they need more immediate pain relief. Alternatively, there are topicals that produce localized relief, so long as the neuropathy is like towards the close to the skin, like maybe an inch and above. It's a lotion. You put it on, and it works. So you're deciding, you're interested in cannabis. You heard your doctor talk about it, or your other people's doctors talk about it, or other people talk about it, and you've never tried it, and you're interested. Where do you start? Well, you have to first find out if it's legal in your state. whether recreationally or medically or neither? And if it is legal, what are the laws governing it? There is a website called Normal. It's NORML.com, and they have a map on there, and you click on your state, and it pulls up all the laws that are governing your state in accordance with cannabis. It's a pretty good tool. If you're looking, okay, if it's not legal in your state, then I don't encourage you to try it. It won't be long. More and more states are, more and more coming along, becoming legal, and in my opinion, it won't be too much longer before the federal government legalizes it. But if it's medically legal but not recreationally, then you need to, if your doctor doesn't work with cannabis, then you need to find either your PCP or neurologist or a pain management doctor. I'm not sure who you see for your condition. I have both a neurologist and a pain management doctor. But either of them can, if they work with cannabis, they should be able to write you a prescription, and then, like I said, Normal will have all the laws, and your doctor should be able to help guide you the right steps, because each state is different in how you actually get your marijuana medical card or prescription, or however each state does it. So that's the first step. Just go through the steps. And if it's legal recreationally, I still encourage you to talk with your doctor about it, because I will tell you, as you experience different cannabis, not every strain relieves your pain. I've had strains actually increase my pain, and you're reaching for the milk at that point. The orange juice, whatever. But not everyone's gonna. So if you do happen to come across a strain that does, you may better take note of it. You know what I mean? And it wouldn't be a bad idea to look into the terpenes that are found in that particular cultivar or strain, and that way you know what to avoid in the future. But if you're looking, okay, so you got all that straight. If you're looking to avoid the psychoactive effects, then you want to look for strains that are high in CBD and low in THC. And that may be strains like ACDC, Canatonic, Harlequin, and I'll list these in the description. And there are more. However, research has found that patients that combine both CBD with THC together, they experience improved sleep quality. And to me, this is one of the most important aspects cannabis plays, at least in my life, because dealing with chronic pain, you're stuck. You're stuck at home. You don't go anywhere. You don't get visits. It's extremely isolating. It's extremely lonely, and you can get downright depressed at times. And cannabis, it truly gives you, when you combine the entourage effect of both CBD, THC, CBG, all the different cannabinoids together, it enhances your subjective outlook on your condition. It truly does. And it can really brighten your day. I'm telling you. And to me, that's one of the most significant parts of cannabis for me. But some strains, cultivars that patients have um, reported as a favor at bringing all these around is Northern Lights, White Widow, and Blueberry. I haven't tried any of them yet. It's on the list. I do want to say each person's endocannabinoid system is unique unto themselves. Like immune systems or DNA, what may work for somebody, and I mean miracles for somebody, it may not do anything for you. You may not like it at all. Um, to, um, my personal experience with cannabis, now I was in my pain management doctor's office today, as a matter of fact, and I'm topped out, basically. And my pain continues to increase, my condition continues to deteriorate, and you know, I'm telling you, I truly find it a blessing to be able to be in a state that is now legal for me to grow a minimum amount of plants, enough for me, to take care of what I need throughout the day. Um, I really don't know where I'd be without it, honestly. But, you know, each person's experience is going to be their own. And as you experience more and more with it, you'll figure out why people they literally fall in love with this plant. They really do. This is very significant, and I want to make it perfectly clear that I'm not saying to do this. I'm saying do not do this. Don't stop any current medications you are on because you think cannabis is going to take your pain away to the extent that your medication does. It's not like that. It doesn't work like that. It's more like, now it does relax you. It does bring the body relaxation. It does that. It does the mind relaxation. But what it does, more importantly for me, is that it takes your mind off of your pain. When I don't have smoke, it's all I can think about. It's all I can concentrate on. Because it is so freaking loud, And then you get sick of talking about it because you only hear your voice because it's all you talk about. And it's like, ugh. And sorry about that. I'm just saying don't stop any medications. Let's see how it affects you first. That's pretty much all I have today on cannabis and how it works in treating chronic pain, and that's just kind of a quick overview. I didn't want to make it too long, and I didn't want to get lost. Sometimes I have a habit of just going on and on and on. Anyway, I do want to make it known that a lot of the information I got here, and what I've read to you today or talked to you about today, I got from a combination of two separate articles. One was, and both of these articles are found on leafwell.com. One of them is titled 8 Best Strains for Neuropathy by Shanti Ryle. And the other one is 6 Best Strains for Chronic Pain by Deepak Hemraj. And I do want to say that LeafWell.com is a good source for a lot of good information when it comes to cannabis and chronic pain. And they actually have specialists you can actually speak with, a live one-on-one person, not for free. I'm not quite sure, $40, $50, I think, something like that. I don't know, it could be $30, but you know, it's information, and but their website's free. You know, both of those articles were reviewed by Dr. Louis Jassy. Louis Jassy is a medical director of pediatric medicine. He's been a pediatrician for over 25 years. He runs a practice of 15,000 patients. He's on staff at 5 different hospitals. And he's carved a niche for himself working with patients on the spectrum and patients with a myriad of mental health disorders, or mental health issues, I should say. He lectures on the national level with expertise in pharmacogenetics and pharmacology. 2 articles on leaf field that Dr. Jassy wrote. One, what are the benefits and side effects of medical cannabis for kids? And the second one is how to get a medical marijuana card for my child. I want to just thank everyone for taking the time to watch this video. I hope it's informative. If there are anybody that has any suggestions for people, even myself, because you know, I'm kind of from old school. You never knew what you were getting. It's trial by fire, baby. And I'm just now getting the benefit of knowing what I'm smoking and able to put 2 and 2 together. So I just hope that this video finds everybody well, serene, and as pain-free as possible. Keep fighting the fight. Keep your head up, because I know it's hard. My heart goes out to you. Much love. Carry Life 420. Bye.